Okay, go.
We're now going to talk about the bones of the leg, beginning with the femur. When we look at the femur, we have, of course, the body or shaft, which is the length of the bone of the femur. At the very tip of the femur, we have the head, which is the large ball-shaped structure we can see, and the neck, which comes down from the head. Within the head, we have the fovea capitis, this small indent or divot that we can see. Now, as we come down the neck, we can see the greater trochanter sticking up and the lesser trochanter sticking down. On the front, there's a very subtle connection between the two trochanters called the intertrochanteric line. If I rotate to the back of the femur, we see the much more conspicuous intertrochanteric crest connecting my greater and lesser trochanters. Along the back of the femur, we have a ridge called the linea aspera, running down the length of the body or shaft. We now get down to the structures that we find in the bottom portion of the femur, close to the knee, and it's always important to remember that the head is pointing towards the hips. Thus, the head is angled medially, making this the medial side of the femur. The features that we can see if we wrap our way around, most conspicuously, we can see the medial condyle and the lateral condyle, these two surfaces. Between the two is the intercondylar notch or fossa. Above the condyles, we have the medial epicondyle on the medial portion, and the lateral epicondyle on the lateral portion. Just above the medial epicondyle, we have a small little bump we can see called the adductor, ADD, adductor tubercle. And lastly, on the surface of the front of the knee, we have the patellar surface, which would be responsible for receiving the patella. If we take a look at the patella, we can see that we have a flat base at the top and we have a pointy apex at the bottom. We can also look at the anterior and posterior surface. The anterior surface is relatively rounded and smooth the whole way across. There's no real jaggedness to it. Whereas on the other hand, the posterior surface is both pointy, which we can see by this very sharp hill, and is not so smooth. There's a little bit of a cliff if we look at it on the right angle. So we have base, apex, anterior surface, and the hillier posterior surface. Moving now to the bones of the lower leg. The major bone of the lower leg is, of course, the tibia, which, with all these long bones, has a body or shaft. At the top of the body or shaft, we can see the medial condyle. We know this is the medial side because at the bottom of the tibia, we can see the very conspicuous medial malleolus, that inside bump on your ankle. And we have the lateral condyle on the opposite side. Between the two condyles, we have the tibial tuberosity. If we go to the top of the tibia, we see this projection of bone right here, which is called the intercondylar eminence. Running down the front of the tibia is the anterior border or anterior crest. And at the bottom of the tibia, we have the fibular notch, which in this intact case is occupied by the fibula. It's a fibular notch occupied by the fibula. Here we see the fibula, the smaller bone, which again has a